Dr. Chris McGibbon, Professor, Faculty of Kinesiology, Research Chair in Rehabilitation Biomechanics at the Institute of Biomedical Engineering, University of New Brunswick in Fredericton.
So my main program is in movement biomechanics. So that's why we would do in this lab. And that typically involves looking at how people walk and jog or run or move about who don't have impairments, because then we learn what strategies people use to move. And then we also do research on individuals that have impairment. For example, limb amputation, which was actually a program that was funded by NBHRF a few years ago. As well as people that have stroke or multiple sclerosis, have difficulties moving. So by looking at how they move in a very detailed way, we can understand how they compensate for those impairments and help their physiatrist or a clinician manage their treatment programs. Now the other area is focus on balance. And so that research is more aimed at trying to determine how individuals with, say, a head concussion, for example, how their balance would be affected by that condition. And again, for the same purpose, to try to understand what could be done to help reduce those impairments. We learn a lot by doing research in here using these very sophisticated technologies, but we can't take those out to the field. We can't put these in a clinic. So at the Institute of Biomedical Engineering, we've developed a system called the Biotone system that is essentially a set of sensors that get placed on the body that communicate wirelessly with the system and deploy these in a rehabilitation setting such as the Stan Cassidy Center, which is one of our partners. Well, NBHRF has been quite valuable in terms of providing funds that otherwise probably wouldn't have been able to be acquired. For example, a few years ago I had applied to the Canadian Institutes of Health Research for funding and through the Regional Partners Program. So I was successful in getting that funding, but the NBHRF provided the matching funds for that, and otherwise that research wouldn't have been able to be carried out without those matching funds. So it's quite critical. And they have other programs that we're also looking at to tap into.